The next slide looks at another critical factor in health, which is obesity. And the green bars here are from the 88 to 94, data from 88 to 94. The blue bars are the most recent data, and we can see that in every case here, the total differences by race, difference by sex, the direction is not what was desired, okay? And we've moved away from this. If we turn to the next slide and look at this on the for children and adolescents, we see essentially the same picture, but with changes that are even greater. So the agenda, if you will, is before us, and of course there are a number of interventions underway, including the intervention and program campaign under the First Lady. But this is the challenge. A lot of change over a very short period of time in the wrong direction. Another factor on the next slide that's important in cardiovascular disease is high blood pressure control. Here we wanted an increase, and in fact what we've seen is an increase across the board by race, ethnicity, by sex. This is all very positive, below the target that was set. But still, these are significant changes over a short period of time. Another critical risk factor, of course, is cigarette smoking, and that's on the next slide. What we wanted here was, as the little box says, a decrease is desired, and in fact, that's what we've seen pretty much across the board. Okay? Well, and as far as this slide is concerned, it is across the board. Okay? And this is for adults. On the next slide, we can take a longer. Oh no, go back one. We can take a longer look at this, going back to 1965, and see that in fact the cigarette smoking has declined over all of this time, with the rates of decline much greater than. And the thing to be concerned about here is the fact that the pace of decrease really has slackened over the last several years. We've been in the right direction during this decade, but not at the same rate we saw before. On the next slide, we look at this for children, okay, and go to the next slide. And we can see, again, the change over time. The direction here is actually positive in the sense that we're going down. Just a couple of more slides here. The next one is one of the critical measures of health of the entire population. When we compare health across countries, we often use infant mortality, we use longevity. It's really a critical measure. What we see here is that we see the persistence again of disparities. Very little change from 1998 to 2006 in these measures. The next slide goes back much further, back to 1940. And we can look at the difference between the white population and the black population in infant mortality. And what we see is, of course, the slackening of the rate of change in the more recent time. But the other interesting point here is that the disparity, which on the slide looks much greater in 1940, turns out the relative disparity has actually increased. If we look at the difference between the black rate and the white rate, it's actually greater today than it was then. Even though in magnitude it's higher, if we did it on a percentage basis, it's actually greater today. Next slide. All of this data comes from many, many different sources. About 45% come from just 4 sources, which actually is very positive that we have it's localized. We don't have all the detail that we would like in these sources, but we have a good deal of it. The remaining 55%, though, come from another 150 sources, and it is a challenge to corral all of this data and do it in the kind of demographic specificity that we really need to understand the disparities. So my takeaway messages on the next slide are that we have made significant progress toward the objectives. I don't think there's any question about that. However, this is tempered by the fact that these health disparities persist, and there's been very, very little change there. Obesity stands out as perhaps the risk factor that has gone most in the wrong direction over this period of time. And what's clear is that we need to have data to be able to mount these programs, track these programs, set the goals for these programs, track them and understand and evaluate them. So it has to be a priority. Much more, on the last slide, there's much more information on the web. I encourage you to take a look at it, and this report I think is going to be extremely valuable as we understand the progress that we've made and the challenges for the future.